Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, the Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole lors de la séance d'information de cet après-midi. Le Dr. Jennifer Russell, médecin hygiéniste en chef, le Premier ministre de Nouveau-Brunswick, l'Honorable Blaine Higgs. Dr. Russell.
Thank you, Bruce. Good afternoon, everyone. Bon après-midi. Nous nous retrouverons présentement dans une phase difficile de la pandémie de COVID-19. Le nombre de cas augmente, tant ici, dans le reste du pays et le reste du monde, et nous avons beaucoup de travail à faire pour ralentir la propagation du virus. Mais nous avons toujours l'espoir. We are still doing relatively well in comparison to other provinces and states across North America and many countries in the world. Our infection rates in Atlantic Canada are lower than most provinces in Canada, and we have as yet not faced the rapid and uncontrolled growth in COVID-19 cases that some communities are now seeing. While we have a number of active cases still under investigation, we have not yet confirmed whether cases related to the ongoing outbreaks represent untraceable community transmission in Zone 1 and Zone 2, so those investigations will continue. Community transmission has been confirmed in the Halifax area by Nova Scotia Public Health, which is one of the reasons that we are now advising caution regarding non-essential travel within the Atlantic provinces. Les zones 1 et 2 sont présentement dans la phase d'alerte orange du plan de rétablissement, mais elles pourront revenir à la phase jaune si tout le monde respecte les directives de la santé publique. Les éclosions en zone 5 et celui avant en zone 1, on a retourné dans la phase jaune après 2 à 4 semaines. Alors, c'est possible de ralentir la propagation si on travaille tous ensemble, parce qu'on l'a déjà vu. Je tiens à remercier tous les résidents de ces deux zones pour les efforts qu'ils déploient afin de réduire le risque que le virus se propage davantage dans leur collectivité. Vos sacrifices peuvent sauver des vies et sauveront des vies. To bring these zones quickly back into the yellow phase and keep the rest of the province at this level, we must all remain vigilant in the days ahead. There has never been a time when the risk has been zero during this entire pandemic, nor will there ever be until there's a vaccine and we all receive it. So we do have to act like it's in our communities before it arrives. It is very concerning to see the number of cases rising globally and across our country. The reporting today of our new cases include 15 new cases of COVID-19 in New Brunswick. And I will say that with the exception, in total, I think we have 89 active cases in total at the moment. And of those 89 cases in total, my understanding is there are 13 that are still under investigation, which means the rest of them are travel-related or close contacts of travel. So today we have, in Zone 2, we have 11 new cases. In Zone 1, we have 3 new cases. And in Zone 3, we have 1 new case. And, you know, a long list of individuals and their ages, et cetera. But this information is available on our website. And honestly, I haven't minded reading those lists because the numbers compared to other places in Canada are small. And in fact, if we were living in any province west of New Brunswick, I would be saying that there are now 1,000 cases, today. But I'm not. But with all the new cases, we do want to keep them in our prayers and in our thoughts, as well as those people who are self-isolating at home. Aujourd'hui, j'annonce qu'il y a 15 nouveaux cas de COVID-19 au Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de Saint-Jean, de Kings et de Charlotte, il y a 11 nouveaux cas. Dans la zone 1, soit la région de Moncton, il y a 3 nouveaux cas. Dans la zone 3, la région de Fredericton et au centre du Nouveau-Brunswick, il y a 1 nouveau cas. J'ai également le regret d'annoncer qu'une autre personne est décédée de la COVID-19, soit le 7e décès dû au virus dans la province depuis le début de la pandémie, et j'offre mes sincères condoléances à la famille de la personne décédée. Et sachez que l'ensemble de la population du Nouveau-Brunswick partage votre deuil aujourd'hui. I must also report that we have seen another death in an individual due to COVID-19, our 7th death since the pandemic began, and I offer my sincere sympathy to the family of the deceased. Please know that all of New Brunswick grieves with you today. There are currently 89 active cases. Je vais dire ça en français parce que j'ai déjà dit en anglais. Il y a 89 cas actifs maintenant du COVID-19 au Nouveau-Brunswick et il y a personne dans l'hôpital maintenant. Et tous les cas qui sont actifs maintenant, ils sont tous reliés soit au voyage ou à un contact étroit de quelqu'un qui a voyagé ou des cas qui sont transmis dans la chaîne de transmission, sauf que 11 sont encore sous investigation encore. So again, remember that the cases that we are reporting today are the result of actions taken up to 2 weeks ago, although we do see that sometimes it takes about 5 days for people to become exposed, then develop symptoms and get tested. So sometimes that can take about 5 days, but certainly up to 2 weeks, as you know, is the incubation period. The sooner that everyone commits to following public health guidance, the sooner our case numbers will begin to decline, and those zones in orange will be able to return to the yellow phase of recovery. As we saw in the outbreak in Zone 5, it took about 4 weeks, and in the last outbreak in Zone 1 took 2 weeks. Please wear a mask when you are out in public and continue to maintain 2 meters of physical distance from others at all time. Keep your number of close contacts extremely low. Everyone is safest when they stay home and don't host people in your home, and when you use your mask, when you go out and when you physically distance. These are all layers of protection. Tous les citoyens sont davantage en sécurité lorsque tout le monde prend ces mêmes mesures. It remains vital to wash your hands regularly and thoroughly, and to remember to not touch your face. It's very important to reduce your close contacts to the lowest level possible. In Zones 1 and 2, this means maintaining a one-family bubble, and I would strongly recommend that all New Brunswickers be cautious about their casual interactions with others, even people you know well. And coming back to the one-family bubble, the clarification around that includes a caregiver coming into your household, or if you have a family member who is living alone and is isolated, providing care and support to that person, or if you have custody arrangements with your children. Vous pouvez vous sentir à l'aise de vous asseoir près d'un voisin ou d'un collègue. Et ce dernier pourrait se sentir à l'aise d'assister à une fête organisée par l'ami de l'un de ses amis. Et ses amis sont convaincus que leur famille et leurs amis ne sont pas à risque. No one is spreading COVID-19 on purpose, I can assure you. All the outbreaks we've seen, a lot of people have not had symptoms, and when they did develop symptoms, they had already been in contact with others. So nobody is knowingly spreading COVID-19, but it still happens because people can be pre-symptomatic and asymptomatic, and that they are contagious during that time, and that is when they are spreading COVID-19. And it only takes one case of an infection for the virus to spread along the chain of contacts. We need to break the chain in order to reduce the spread of COVID-19. That is why that I say everyone should stay home as much as they can and avoid non-essential travel whenever possible. And I do realize that these things are hard, especially at this time of year when we all want to celebrate the season with family and friends and colleagues. But it is so very important. So please reconsider any of the plans that you had. Please cancel your plans to gather. Please don't host gatherings. We must support each other to maintain our resolve and keep our spirits up during this time. Please look after yourselves. Please look after one another. Eat healthy foods. Get enough sleep. Prenez contact avec vos amis, vos voisins et les membres de votre famille. Faites preuve de gentillesse, de compassion et d'empathie envers les autres et envers vous-même. And when you need help, reach out. There are resources in your community that are ready to assist you when struggling. Please visit our website or call 211 for support. Remember to focus on what you can do, not what you can't do. And everyone can take small actions every day to slow the spread of this pandemic, to protect our citizens, to protect our businesses, to protect our vulnerable populations, to protect our schools, and protect our hospitals. In this way, we will maintain our place as the envy of Canada and the world. Thank you very much.
Good afternoon. Bonjour. As Dr. Russell has said, New Brunswick has experienced another death related to COVID-19. This is never easy news to share. On behalf of all New Brunswickers, I want to extend a sincere condolences to the family and the friends of this individual. Our thoughts are with you, and our province grieves your loss. Today, Newfoundland and Labrador and Prince Edward Island are making some changes to their participation in the Atlantic bubble. But for the time being, New Brunswick will not be. Prince Edward Island and Newfoundland and Labrador will require all travelers, including MD travelers, to self-isolate for 14 days upon arrival. The new rules come into effect at midnight for PEI and Wednesday, November 25th for Newfoundland and Labrador. New Brunswickers traveling to PEI and Newfoundland and Labrador, including those going there to work, should contact the governments in those provinces to determine how today's changes affect them, what conditions are required, and whether any registration or pre-approval is required. Today's changes by PEI in Newfoundland and Labrador do not affect New Brunswickers returning home after working in those provinces. Last week, New Brunswick announced that cross-border New Brunswick workers other than truckers, daily commuters, or those under a plan approved by WorkSafe would need to undergo self-isolation for 14 days unless they volunteered to test for COVID-19. The people who do volunteer to test for COVID-19 would only be exempt from self-isolation if they have no symptoms and test negative after their first test, which would be conducted 5 to 7 days after their return to New Brunswick. I join my fellow New Brunswick premiers in cautioning against all non-essential travel over the next 2 weeks outside of our respective provinces. Now is not the time to travel to other areas or to do your holiday shopping. We need to shop local. It's not only time to protect ourselves in each of our provinces, it's a time to support the businesses within each of our provinces. While certainly the residents in where the orange level, in zone 1 and 2, this is mandatory or certainly a must that they do not travel outside of their zones. We want everyone to do the same thing, even in the yellow zones, to be cautious, but to stay at home if you can, but be cautious when you do travel. We're making our decisions based on the advice of the Atlantic Chief Medical Officers of Health. For people living in zones 1 and 2, there are a few basic differences from life in the yellow phase. Some of these are a little different than the last time you were in orange. The biggest thing is you need to wear a mask indoors and out, anywhere in public. These exceptions are very few. The next big thing is you can't have people into your home. You shouldn't be spending time in close contact with anyone you don't live with. In fact, restaurants and bars now have to make sure they don't seat people together who don't live together. These restrictions are intended to reduce transmission and flatten the curve, while at the same time keeping as many businesses that have been following the rules open. We're trying to do that and still keep people living and learning and working. That's why we've created rigorous protocols for schools, so kids can keep learning, even in orange. It's why we require extensive protections in every workplace, so people can keep working. We made one significant change to the yellow phase last week. Informal gatherings are now limited to 20. We still allow larger numbers in control settings. The 20 is for informal gatherings in the yellow phase zones. We have already made it clear that we are no longer monitoring the provincial borders, and that would be provincial borders between ourselves and Nova Scotia and PEI. We will continue, however, to monitor the borders in northern part of the province between ourselves and Quebec, and we are enhancing our monitoring of the U.S. border. Les policiers, les agents de la paix, les inspecteurs de la santé publique et l'inspecteur du travail sécuritaire Nouveau-Brunswick visitent les entreprises et les espaces publics partout dans la province pour s'assurer que les règles sont respectées. People who refuse to comply with provisions of the mandatory orders, such as masking and physical distancing, can be charged, and they will be. More than 30 fines were issued across the province over the weekend for violations of the Emergency Measures Act. Almost all were related to failing to wear a mask. A reminder, masks are required both indoors and outdoors in the orange zones. Officers aren't just checking mask usage. They are also inspecting businesses and all public places for compliance with the mandatory order, which includes, but is not limited to, masking and the presence of COVID operational plans. Compliance at businesses could be better. Inspectors issued dozens of compliance orders, and they will be following up on these orders and conducting more inspection to ensure rules are being followed. Non-compliance will be dealt with. Another change you will notice throughout the province: if you are going to a restaurant or anywhere else, you will be sitting, expected to be asked for identification. There will not only ensure that those sitting together, this will ensure that they are in the orange zones are keeping their one family bubble intact. It will also make sure that the names being given for contact tracing are valid. It's important that we understand movements, and it's important that the family bubbles are protected and we're allowed to beat this current outbreak. It's disappointing to learn that during contact tracing, public health has discovered that some people have not been giving their real names and contact information when they've been asked. It is disheartening to see a number of active cases steadily climb, but these cases were expected. These cases are known due to the tremendous efforts in contact tracing. We have hundreds of people now that are either isolating or that are being monitored for symptoms, and we are in contact with them as required. And today, all 15 cases announced were already identified and isolated. A third vaccine has shown promising results and is now in late-stage trials. So this is not the time for us to falter. This is a time for us to go the extra mile to protect each other. It's time for us to stay at home. It's time for us to stay in our province. It's time for us to take these 2 weeks to get our control back together. And then we get back to normal within the Atlantic bubble and within our routine living within COVID. We are so close to the finish line that we can't lose hope or lose sight of it. But now is the time to dig deep, to remember why we've been careful thus far. When we follow simple rules, it will not be difficult to get across the finish line successfully. Nous faisons tout cela pour assurer la santé et la sécurité de tout le monde. Nous faisons tout cela pour sauver des vies. Let's continue to show the rest of the world just what New Brunswick is capable of. Let's continue to be number one, not only in COVID and dealing with COVID, but as we move beyond COVID. Let's not lose hope or our diligence to put this COVID back in the box, to make sure that we will continue keeping people safe and our families secure. Thank you. Merci.
Merci beaucoup, Monsieur Premier Ministre. Dr. Russell, thank you, Premier. Thank you, Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have only one question, and you have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste peut poser une qu'une question, et vous avez le droit de poser vos questions dans les langues de votre choix. Jean-Philippe Hugues, Radio-Canada.
Oui, excusez-moi. Ma question, c'est pour Monsieur Higgs. puisqu'il y a de transmission communautaire en Nouvelle-Écosse, pourquoi avez-vous choisi de garder la frontière ouverte avec la Nouvelle-Écosse?
Thank you for the question, and Dr. Russell may comment on this as well. Certainly, in the case of what we are tracking here in New Brunswick, we're very cognizant of we have good contact tracing. The issue in Nova Scotia is in the Halifax region. In our discussions with Premier McNeil yesterday, they're very focused on testing in that region. They're encouraging people not to travel outside the region, not to travel from other regions into the Halifax area. We want to continue our focus on adherence to the public health rules throughout New Brunswick, and that means going into our zone, particularly the orange zones, in the businesses and in the community, and seeing people are following the rules. We want to keep our resources deployed along our northern borders between New Brunswick and Quebec, and to enhance our activity along the border between Maine and New Brunswick. So we feel that that is the best use of our resources. We're aligned in containing this in Nova Scotia and New Brunswick independently, and I think we're best served to ensure that we each follow our own protocols, but we avoid travel, avoid unnecessary travel, and when travel is essential, all the precautions are taken because the virus is certainly live and well, and we're seeing that in both provinces.
Oui, alors je veux juste ajouter que quand que nous, on avait des éclosions dans la zone 5 et la zone 1, et maintenant dans la zone 1 et la zone 2, et on est dans la phase orange, c'est vraiment une détermination par nos épidémiologistes et aussi nos médecins hygiénistes. Alors, quand on a reçu toute l'information sur l'éclosion à Halifax, on a vraiment déterminé que la façon que la transmission est effectivement les normes qu'on voit et la sorte de transmission qu'on voit, c'est quelque chose qu'on va continuer à surveiller, mais à ce moment-ci, c'est vraiment si vous avez besoin de travailler pour des raisons essentielles, quand vous retournez, il faut vraiment suivre les comportements et les protocoles comme vous êtes allé à une zone orange.
Michel Corriveau, Radio-Canada.
Merci, Bruce. Bonjour, Dr. Russell. Il y a des messages de parents qui ne sont pas contents, fâchés, là, quand ils leur disent pas dès qu'il y a un cas dans une école. Il y a un parent qui a souligné, par exemple, que quand il y a un problème de fou dans l'école, on donne des notes à tous les parents, mais pas quand il y a le COVID. Est-ce que c'est possible qu'il y ait plus de transparence là, pour les cas dans les écoles, les institutions, mais aussi dans les communautés et pas seulement là, dans les zones at large?
Alors, Michel, j'ai pas entendu toute ta question, mais ça a l'air qu'il y a des parents qui sont pas contentes dans les écoles, mais je sais pas si c'est une situation, c'est parce que ils ont pas reçu l'information qu'ils croyaient ils devront recevoir, ou ils sont pas contents parce qu'ils veulent pas envoyer leurs enfants à l'école s'il y a un cas dans l'école?
Non, en fait, c'est que les parents aimeraient qu'on les avise dès qu'il y a un cas dans leur école. Comme, par exemple, s'il y a des fous dans l'école, on avise tous les parents. Ils aimeraient qu'on les avise quand il y a un cas de COVID dans leur école.
Alors, la communication entre l'école et la santé publique, c'est vraiment pour donner l'information aux principales. Tous les principales recevraient des informations de la santé publique pour dire qu'il y avait un cas. Mais les contacts étroits seront contactés individuellement. Et s'il y avait une bulle qui était impliquée, les individus dans la bulle seraient contactés individuellement. Et il y a des fois que c'est peut-être même pas un cas, mais quelqu'un qui est un contact étroit. Et alors, c'est même pas un cas encore décidé ou diagnostiqué. C'est quelqu'un qui est à la maison en isolement à ce moment-ci. Et des fois, s'il y a plusieurs gens qui sont en isolement, il y a des fois que ça veut dire que peut-être une classe ou toute l'école va être fermée pour un bout de temps si les gens sont en isolement pendant 14 jours. Mais le processus, le protocole qu'on a avec le département d'éducation c'est depuis le commencement de l'année scolaire, c'est toujours été compris que les individus vont être contactés individuellement et les principales vont communiquer avec la population de familles, de parents et des étudiants.
Dr. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, a federal clause states that remote Canadian communities of Campobello and Stewart, BC can obtain essential goods in the closest American community to them. But when Campobello Islanders still call the provincial travel registry, even today, they're being told they have to quarantine for 14 days if they stop for essentials in Lubec. Does the federal clause trump the provincial order? How should Islanders proceed when obtaining essential goods?
It is disappointing that this really can't get clarified in a way that's understandable to the residents, and I'm going to take that on personally to get this resolved. It's certainly, we need a consistent message that goes from our Canadian officers and the U.S. officers that allow Campbell residents to know exactly what they need to do and how they can manage their life within COVID. So I am going to get exactly the rules, and in our next presser, I'm going to have those available. So, and we will communicate that on the island. So this confusion ends, because I am sympathetic to the situation that exists there. I am to understand they're able to move, obviously, back into New Brunswick from Campobello through Maine, and that they do have the capability to go and follow all the rules, mind you, but for essentials, that would be a concern for them to access nearby in Lubec. So I will make that commitment, and the next newser we'll have that well defined.
Thank you, Premier. Thank you, Ms. Hogarth. Ben Burnett, CHSJ News.
Thank you. I'm wondering about the mask regulations. I'm reading from the GNB website here. A mask is not required while walking with people in the same bubble. Hearing social media reports this weekend of folks having, whether it's COVID officers or people out enforcing COVID guidelines, telling them to wear a mask while they were alone or even on their property or in front of their property. I guess I'm just wondering, if I'm on an empty sidewalk with no one nearby, is it, according to the website, it would seem that that should be legal. I just looking for some clarification.
No, okay. And we've had some complaints in this regard too, and the idea is in the orange zone is that anyone that is outside in a public space that cannot maintain a social distance and has the possibility of running into someone within 6 feet, then they wear a mask. And, you know, it's kind of hard. Everyone could, or people can claim I'm in a bubble, so it's not a problem. But we're asking people to just follow some very simple rules. This is in the zone orange. This is at a time when we don't know where all of the cases, you know, could come from. We think we got them all traced right now and contacted, and we want to keep it that way. So, and that's why we're saying today, and we're talked in the last few days about staying within your own province, but staying within the own orange zone. So, I understand there's some confusion when walking down the street, but when in doubt, put a mask on. And I can appreciate if you're out in front of your house and this is on your property, then the public shouldn't be on that. That should not be a problem. If you're walking down a trail where you're meeting lots of people, then put a mask on. Let's not find as many reasons as we can possibly find not to wear a mask. Let's find a reason why we should wear a mask so we don't take a chance. Thank you.
Thank you, Premier. Thank you, Mr. Burnett. Elizabeth Fraser, CBC.
Hi there. My question is for Dr. Russell. Why don't you, as some epidemiologists suggest, require bartenders and restaurant servers to get tested, since they are often young and therefore unlikely to show symptoms and gather together and see many, many people in the room a day?
Hi, that's a great question. And obviously right now we're increasing our capacity to test. So anybody who does have actual symptoms, it's a really great idea to get tested. We have in the past allowed healthcare workers to get tested who are asymptomatic, as well as teachers. So we can take that back and look at that. But I am aware that in Nova Scotia they were offering testing to that population.
Thank you, Doctor. Thank you, Ms. Fraser. Natalie Sturgeon, Telegraph Journal.
Thank you, Bruce. We know, my question is for Dr. Russell. We know from Horizon that 54 people or workers are self-isolating. As well, we've been hearing that the St. John Police Force and the St. John Fire Department also have people and employees self-isolating. At what threshold does this trigger the red phase, and at what point does public safety outweigh the economy?
So our triggers, we've been monitoring every single day for all outbreaks. We reassess them as the case numbers come in and as the type of transmission that we're seeing and what the impacts are on the healthcare system. Obviously, the contingency plans for all different organizations, they have a contingency plan in terms of what percentage of the population of their organizations they require to be able to function. I haven't heard from any of those organizations at this point in time. But we have conversations with Horizon and Vitalité on a daily basis around their capacity, because that the healthcare service delivery, healthcare workers that are impacted, ICU bed capacity, et cetera, those are all things that are looked at when we look at going a trigger to go to the red phase.
Thank you, Ms. Sturgeon. Thank you, Dr. Derek Montague, Huddle Today.
Hi, yes, thank you. My question is for Premier Higgs. Premier, on Saturday's news conference, you talked a lot to the business community about the steps that they need to do. You warned them about fines that could happen, even potential closure if businesses don't follow the rules. You even said that businesses need to make sure that patrons coming in need to be told to follow the rules or be asked to leave. Have you heard of any instances of businesses that aren't following guidelines that prompted you to make those warnings to businesses? And can you give some examples of activities that you think some businesses have done in the province that don't follow the public health guidelines?
Well, there has been a business that was shut down in southeastern New Brunswick because of not following the guidelines, kind of an abuse of what's been out there for some time. We've also had, as I mentioned this morning, there have been some minor infractions, I guess, in relation to understanding, okay, do you know who's here? Are they in the bubble? Are they coming from a family unit? Or are they just, 4, 5, 6 people got out for the evening? So the new regulations within the orange zone is basically, if your family's traveling together, we just need to be sure of that, because it's a case of, again, keeping the exposure to transmission very clear. The other aspects of accurate records, so that the information being provided is accurate, because we're seeing cases where the information, when tracked, it wasn't the same person, or there wasn't a person there by that name. So it's unfortunate, and it's concerning that some folks believe they're beating the system. This isn't. You're not beating the system. You're jeopardizing the health and welfare of maybe your neighbor, maybe your grandparents, maybe your parents, and we're seeing a demographic here that is certainly that would be more, let's say, active in the night scene. So from 20 to 30-year-olds that have really ramped up in the recent weeks, and that's why cracking down on restaurants, bars that have restaurants in them, it's important. We're trying to keep the businesses going, but make no mistake about it. If we cannot get people to say, look, I can be part of this solution, then the next step is move into a different color, or to make changes in the businesses, or to shut them down one by one as non-compliance is exposed. We need people to all play a role here. We've been doing so well. This is not the time to get lax in our rules and get lax in our behavior.
Thank you, Premier. Simon Delac, l'Acadie Nouvelle.
Oui, une question pour le Premier ministre Higgs au sujet donc, de la fin de l'appel atlantique. Est-ce que le Nouveau-Brunswick a été fait partie de la conversation? Est-ce que c'est une décision commune ou une décision des provinces qui ont décidé de se retirer?
It was a shared decision. I had a meeting last night, or a teleconference last night, with the other 3 premiers, and we certainly understand, the situation that Newfoundland, Labrador, and PEI are in, and their concerns with our current situation in New Brunswick and Nova Scotia. We feel this will be a 2-week kind of a circuit breaker, as it's being commonly known as. But it was well understood. We understand their rules around people coming and going and the enforced isolation, and they understand why we're trying to keep things moving within our province between Nova Scotia and PEI, but doing so only for essential services, and doing so with telling people, let's stay within our own province. We're putting our resources on activities within our collective provinces. As I've said, that was certainly a joint effort and a joint rationale that Premier McNeil and myself agreed was the best place to focus our efforts.
Merci beaucoup, M. Delatte. Sophie Desautels, Radio-Canada.
Oui, bonjour. Ma question est pour le Dr. Russell. Est-ce que ce serait possible d'avoir un peu plus de détails sur les nouveaux cas, en particulier les 11 nouveaux cas dans la zone 2? Est-ce qu'il y a des cas dans les foyers? Est-ce qu'il y a des cas dans le système de santé, dans les écoles? Pouvez-vous nous faire un peu la nomenclature de ces cas-là?
Alors, on a des cas, une éclosion a été déclarée à Stan Cassidy Rehab Center à Fredericton, et il y a des cas dans les écoles, mais ça, c'est les seules choses que j'ai pour des endroits où on voit des cas dans les différentes zones. Alors, je vais donner les détails sur les écoles. Alors, dans la zone 2, c'est à l'école Centre-Ville. Elle a un cas positif là. Et à zone 2 aussi, je m'excuse, c'est la zone 3, c'est la zone de Fredericton, la région de Fredericton, mais ça, c'est une grosse région. Alors, Montgomery Street School. Et dans la zone 2, à la région de Saint-Jean, il y a des cas positifs à Hampton Middle School, Simons High School, à Saint-Jean et autre que ça, Harborview High School. Alors ça, c'est les autres endroits où on a eu des cas ou des possibilités des cas. Mais il y avait 11 cas en total.
Merci, Docteur. Merci, Mademoiselle. Merci, Docteur. Merci, Mademoiselle Desautels. Marie Sutherland, CBC.
Good afternoon. My question is for Dr. Russell. We're hearing of some instances where there's been a lag, sometimes 3 or 4 days, between the business being informed of a positive case and all trace contacts being notified. I'm just wondering, what's the ideal amount of time between identifying a positive case and contacting all the potential exposure victims, I guess we call them, and what is public health, our public health average lag time in this regard?
Our goal has always been to do contact tracing within 24 hours, but that can be extended to 48 hours. So from 24 to 48 hours, that's our goal, and that's what we aim for.
Thank you. Travis Fortnum, Global.
Hi there. My question is also for Dr. Russell. It's about the Tucker Hall Shannock facility in St. John. I'm wondering if any of the new cases confirmed today are either residents or staff there, and what guidelines are in place at that facility.
None of the new cases are from there, but we will continue to do mass testing of the residents for the next several days. So the next time they're going to be retested will be tomorrow.
Thank you, Doctor. Thank you, Mr. Fortnum. Laura Lau, CTV. Laura Lyle.
Hi, sorry about that. My question is for Dr. Russell. We're just wondering how accurate are reports coming out that the outbreak here in the St. John region can be traced to a single event. In this case, what we're hearing, a dinner theater where several essential workers, including possibly police officers, were reportedly present and are now self-isolating.
Well, the only details I can provide are the fact that all the close contacts have been linked. So in terms of community spread, we're not seeing community spread. We've been able to do all the contact tracing and that they're all linked. That's all I can say for right now.
Thank you, Laura. Tori Weldon, CBC.
Hello. What's the latest on the outbreak at the nursing homes in Dieppe?
campus in St. John. I'm just wondering what the test results have been so far, and how's the residents who tested positive in Dieppe doing?
So my understanding is that there's 0 in Dieppe that have tested positive today, but I'm not sure if they're going to continue to do testing every several days, but that's our protocol in terms of following the situation.
Thank you. Allison Sampson, CTV.
Hey, yes. Just wondering, at what point will you close schools? I know you've already, reduced the single bubble families in some areas, but the kids are still going to school and mingling with each other outside of those bubbles. So at what point do you go back to online learning?
So the red phase would be when that would happen, and otherwise, as we've done throughout the entire pandemic, we manage the outbreaks and the exposures and the cases on a school-by-school basis. So the risk assessments are done with each school, with the type of transmission that we see or exposure we see. We work with the classroom, the teachers, the parents, and the principal when the risk assessment is done around what kind of exposure and close contacts are involved. But there's not a necessity to close schools at this point in time as a result of the types of cases or transmission we're seeing. Sometimes for an operational decision can be made at the school level because there could be too many people that are self-isolating or critical staff that are self-isolating and they can't run certain parts of the school that way. But at this point in time, in the orange phase or in the yellow phase, cases are managed and close contacts are managed on a school-by-school basis.
Thank you. Savannah Ott, Telegraph Journal.
Hello, my question is for Dr. Russell. When you say immediate family members requiring support can bubble with another household, support is a pretty broad term. Are you saying that anyone living alone can bubble with others? And can you explain the choice to shrink that orange bubble down to one home just a few months after loosening it to 2?
Right. So throughout the pandemic, we will continue to evolve and change our advice and recommendations based on the risks that we see, and those risks are always evolving. When we know that a lot of the transmission is happening in people's homes or private gatherings, then we do have to manage that risk by targeting the approach in terms of keeping people safe by using that approach. So what we were seeing in other outbreaks, again, is the transmission being driven by private homes, gatherings, etc. So that's the reasoning behind why the bubble has shrunk. I think the concept of a 2-household bubble was challenging to articulate in terms of the spirit behind it and what the safety measures were going to bring to it. But with the 1-household bubble, we're talking about if you have a caregiver that has to come in, then that's acceptable. And then in terms of a family member who's isolated, and from a mental health perspective, that's really hard. So when I say support, I mean support for somebody who's isolated and lives alone in that way, or any kind of support, whether it's physical support or mental support, emotional support.
Thank you, Dr. Russell. Wilden Paul, Radio-Canada.
Merci, Bruce. Ma question est pour le Premier ministre Higgs. Alors, ça porte sur les vaccins contre la COVID-19. J'aimerais savoir comment vous souhaitez qu'Ottawa fasse la distribution des premières doses de vaccins contre la COVID-19 à la province. Alors, est-ce qu'elle doit se faire en fonction du nombre de cas actifs ou de la population? Et allez-vous éviter pour obtenir des premières doses de vaccins?
Throughout this pandemic and working with my colleagues across the country and the Prime Minister's office, we've been it's been a very rational approach as to the need. It was a needs-based kind of assessment on where support should be provided. In the case of the vaccines, I mean, there will be an agreement, of course, on the vulnerable populations and what does that constitute, so that we'll have a definition kind of nationally what that means, and then look at the risk factor in each province. So I think there will be a very consistent nationwide approach as to identifying need and proportionalizing the supply of the vaccine based on that. I'm also encouraged by what I've seen for supplies. I mean, early stages, the federal government have made significant purchase of potential vaccine or reserved supply. And each time we hear of a new one, and now the third one here recently, the federal government appears to be putting reserves in place in order to have access to millions of versions of supply. So I'm quite confident that it'll be administered fairly throughout the country, and based on risk and based on the need in each individual province. So we've worked well together thus far, and I expect that to continue.
Merci, Mademoiselle Paul. Adam here is Telegraph Journal.
Thanks, Bruce. My question's on why New Brunswick stays in the bubble with Nova Scotia. Is this strictly that New Brunswick has limited compliance enforcement peace officers available, or are there other factors here?
Well, it's about priorities, and in the case of between ourselves and Nova Scotia, we both believe that our priority needs to be in how we manage adherence to public health rules, how we basically, enforce those rules within our communities. And in the case of New Brunswick, we know where our current situation, the problems are and the opportunities, and that's in southern New Brunswick. In the case of Nova Scotia, Premier McNeil knows that it's a Halifax region. So the message from both of us is certainly, and it's actually from all of us, is stay at home, and support your local businesses, but stay within your own province. And in our individual areas, we're saying, stay in the zone orange and don't travel in and out of the zone. In the case of Nova Scotia, Premier McNeil saying stay in Halifax region and don't travel, even though this is, these are big shopping weekend that's coming up, don't travel into Halifax. He's saying from outlying regions, and we're saying don't travel outside of our province, outside of our zones in orange. So we're all aligned completely. So putting our resources on our border between two provinces that are completely aligned in how we're going to manage this COVID process going forward, I think would be not a good utilization. We want to put the efforts in surveillance of existing systems and adherence, and we want to continue our focus because we can't forget New Brunswick has been on the front line of the travel focus by land from the very beginning. And we will be able to not only continue that focus, but to enhance that, but do so both for the Maine-New Brunswick border and Quebec-New Brunswick border.
Thank you, Mr. Harris. Erica Butler, CHMA, Sackville.
Hi there. Thank you very much. This is a question for the Premier. I've heard from restaurant owners who say or who believe that they can get fined if they end up with a party of more than one household in their establishment. So I'm just asking, are restaurant and bar owners and workers, are you asking them to ensure that any party that they serve is part of a one household bubble? And would they be fined if they serve such a party, or what should they do in such a case?
We are expecting owners of establishments to follow the public health rules. And in the zone orange, the health rules are to have stronger identification of patrons, so that if you're coming into a restaurant with a party of 6, there needs to be some way to identify that party of 6 is coming and a confirmation they're coming from the same household. And so we're asking for identification, address, and information. And if people, if people say, well, I don't want to give that, then the business owner has an obligation to say, well, unfortunately, due to the public health rules and the the Emergency Measures Act, then I'm not able to serve you in this establishment. And I said the other day, if businesses have problems in that regard with patrons, then they should call for assistance. But we're asking people not to put them in that position, not to try, as I said earlier, to game the system. Just be part of the solution. Let's keep this together and let's not lose it when we're so close to the finish line.
Thank you, Premier. Graham Benjamin, Global News.
Hi, thank you. Thanks for having us. Just have a question for Dr. Russell. Over the weekend, Nova Scotia Health released 34 potential COVID-19 exposure locations over 48 hours, with the recommendations for 15 of those locations being anyone in attendance to arrange for testing immediately. Is that something being considered for any of the potential exposure locations in New Brunswick? And what point does the exposure have to get to in order for that recommendation to be made to get that test immediately?
So those would be decisions that public health in Nova Scotia would be making, and they would be based on risk assessments based on what they knew about cases that had attended those places. For here in New Brunswick, our public exposures were more around the fact that contact lists perhaps were not maintained in a way that we could contact everybody, or as the Premier mentioned, if the information that was provided was not valid. So again, it's based on risk assessments and what we would think the risk would be. We aren't testing asymptomatic people at this time unless public health is directing them to. And so right now, our advice is to self-monitor and get tested at the earliest time that you notice symptoms.
Thank you, Mr. Benjamin. Emma McPhee, Telegraph-Journal.
Yes, my question is for the Premier. I'm wondering, can eviction still happen under the orange phase? And if so, are there any plans in place to bring the eviction ban back?
Yes, it can happen. We have not put any rules in place that would say that under a normal condition, or if there was a situation that was inevitable through the eviction process in any case. However, I think we caution that landlords should be very prudent in the exercise of such activity, because this is a unique situation, especially being in Orange is a unique situation, and we don't need to add stress and strain into the community by someone having to shop looking for a new apartment. So I would ask for diligence here from the landlords not to be putting eviction notices on the door and not to be exercising that situation at this time. But we're not, at this stage, we don't have any particular change in our rules to govern that.
Thank you, Premier. John Chilliback, Daily Gleaner.
Hi there. I think Dr. Jennifer Russell confirmed that Centreville Community School had an exposure, but I just wanted her to say that again if possible, because I couldn't quite hear. Along with Montgomery Street School and a handful of schools in St. John, that there have been some exposures. And if she could comment on what she can say to parents to allay their fears, because a lot of them, if they're sending their kids to those schools, they might be very worried.
Yes. So in Centreville, there is one positive case of COVID-19 at the school, and the school community has been notified. There is a confirmed case at Montgomery Street School, and that school community has been notified. And families of students and staff at Hampton Middle School in Hampton and Simons High School in St. John were notified of a positive case in each of those schools. And in addition, families of students and staff at Harborview High School in St. John were advised of a possible exposure to COVID-19 case. And those schools have been in touch with families and have communicated any potential changes regarding learning. From a parent's perspective, I have mentioned before that I am a parent. Both my kids are teenagers and they go to school. And I am planning to keep my kids in school for the duration of the pandemic unless I get a phone call from public health or I get a phone call from the school that there's been an exposure and that they're not supposed to be there, or the school is closed, or they are being identified as a close contact of a case, or they themselves are a case. So I do understand those fears and concerns, but the way that we've been working with education and early childhood is that we have had plans in place since the beginning of school that we worked on for most of the summer, actually, to make sure that things are done with a risk assessment, with public health, in conjunction with the schools and teachers and principals. And at this point in time, the most recent information that I have is that there has been no student-to-student transmission at this time.
Eric Haggett, Times and Transcript.
Hi, my question is for Dr. Russell. I know you're just asked about the Residence Oasis Senior Facility in Dieppe a few minutes ago, but can you confirm there's just been the one case there and is testing continuing at the residence?
Yep, to my knowledge, there's only been one, but we will continue with our same protocols and processes that we do in any long-term care facility or adult residential facility in terms of testing and isolation, et cetera. So we will continue to monitor that situation.
Tom Bateman, Times and Transcript.
Hi there. For Dr. Russell, and I believe you kind of touched on this just a second ago.
where public health has said that establishments who keep proper records of patrons won't be identified in the event of a public exposure. Does that mean that the opposite is true, and that when a restaurant or a gym or another business is named, within the public exposure list, that's because contact tracers were not confident the business had adhered to the Emergency Measures Act and kept a good registry of people? And if that's the case, then are we going to see those restaurants named, charged in some way, or fined?
So in any situation throughout the pandemic, when we see or find risks, then we have either tried to manage in the past, or it's a new issue and we need to have a new approach to manage, then we will take those steps. At this point in time, if we can't contact everyone, so it's not necessarily that they don't have the list, but maybe they weren't able to contact everyone on the list. So it's a combination of different things, but certainly public health does its best to contact everyone that they can. And if there is a chance that they might miss somebody out of an abundance of caution, they will issue that public exposure notification. And as the Premier was saying, over the weekend, there has been a lot of activity with Department of Public Safety and WorkSafe, making sure that people are complying. These are the same steps that were followed in Zone 5 to make sure that everybody understood the information that was being provided on how to keep patrons safe. Up in the Zone 5 outbreak, part of the issue was around employees infecting other employees and making sure they were wearing their masks. So where we see risks, that's where we target the management of those risks.
Radio-Canada.
Oui, bonjour. Ma question est pour Dr. Russell. Donc, il y a plusieurs propriétaires d'entreprises qui ont eu des crises d'exposition à la COVID, trouvent qu'il manque d'informations quand la santé publique les contacte. Vous avez dit précédemment que la santé publique contactait ces entreprises-là pour qu'elles puissent gérer leur communication. Mais pourquoi alors certains entrepreneurs reçoivent de la part de la santé publique des consignes plus sévères, très précises, comme la fermeture pendant 2 semaines, le nettoyage, et d'autres, il n'y a aucune consigne qui est donnée par rapport à la fermeture ou la quarantaine préventive ou quoi que ce soit? Est-ce que les communications sont égales par tous les membres de la santé publique?
Oui, je comprends la question. Chaque situation est différente. Alors, les directions que les gens vont recevoir de la santé publique, c'est vraiment pour gérer la situation comme telle. Alors, s'il y a une situation spécifique, qui ont des mesures spécifiques qui font communiquer avec eux, c'est ça qu'ils vont faire. Alors, chaque situation est différente. Et on voit ça aussi quand que les inspecteurs vont pour inspecter des restaurants, puis les cuisines, puis des choses comme ça. Alors, il y a aucune situation qui est la même.
Times and transcript.
Hello, thank you. My question is for Dr. Russell. So several provinces with regions of lockdown have changed emergency orders to allow single-person households to bubble together, citing mental health isolation harms, but not putting them specifically in the emergency orders. There's no strings attached. So how are you determining who needs support? And why specifically is someone who has a family member safer, more worthy of support than someone who has a romantic partner, best friend, or favorite neighbor?
Yeah, I hear your question is quite nuanced in terms of the specifics, but the spirit of the order is that it's one single household, and if you require somebody to enter your home to offer support to one of your family members, that's okay. And if you have an individual in your family that requires that lives alone and is isolated, then that person can be in your bubble in the sense that their mental health would be affected negatively if they were to continue to be isolated alone.
Last question, Steve McKinley, Toronto Star. Steve McKinley. That concludes today's update. Thank you very much. Cela conclut les séances d'information d'aujourd'hui. Merci beaucoup tout le monde.